Kevin, we should be coming up. Kevin, good.
Great. Well, good morning, everyone. I want to welcome you to the Health and Wellness Advisory Committee meeting for Charleston, South Carolina. It's June 4th, Wednesday, 2025. It's 8:30 a.m. and I will now call this meeting to order. We've had a beautiful start to June. I'm excited to see this great group gather again today, and I want to thank you for taking time out of your busy schedules, let you know how important your work is to this committee, and let you know how much you're appreciated. We really do appreciate your time and know it's valuable, and it's very valuable to us. So thank you to everyone who does so much on this committee. We appreciate it. As most of you know, it's one of the more active weeks for Charleston with Spoleto Festival in full gear. And for those of you that haven't been, there's still some tickets available to some great performances. And this Sunday is going to be kind of cool because Spoleto, it'll be on its final day, but we're going to have the second Sunday on King Street. So great atmosphere to get out and walk downtown and enjoy downtown where King Street's blocked off just to pedestrian traffic. And today also is the West Ashley Farmers Market. It'll be open 3 to 7 at Ackerman Park. And I know Dr. Durst is going to be talking to us about men's health today, and eating healthy, I'm sure, is going to be part of that. So if you haven't been, there's some of the healthiest, most delicious fresh fruit and vegetables, eggs, meat, honey, all kinds of things out there. There's live music and games in the park. And I know I have some of my favorite Johns Island farmers out there, but they're all great. And it's much better if we can buy local and support our local economy and get that fresh food. So if you wanted to make dinner tonight too, there are vendors with prepared food as well out there. And I understand the blueberries and peaches got an early start. But if you can't make it today, the downtown Charleston Farmers Market will be very busy in Marion Square Saturday as well. So we will now look at our committee minutes. Paul sent out earlier this week minutes from March 5th, April 2nd, and May 7th. Can I get a motion to approve those minutes in a second, please?
So move.
We have a motion to approve. Can I get a second?
Second.
Okay. All right. Thank you. It's been a motion to approve in a second. So any additions, deletions, any other comments that we need to do there? If not, all in favor of approving those minutes for March 5th, April 2nd, and May 7th, please say aye. Aye.
Aye.
Aye.
Any opposed? The minutes have been approved. Thank you. And we've got a great presentation coming forth from someone who you all know very well, Dr. Kay Durst, who is with Roper St. Francis Family Medicine and has a practice on Sullivan's Island, and is a third-generation doctor and an expert in men's health and eating and those types of things. So without further ado, Dr. Durst, if you'll take it from here, I sure would appreciate it.
Oh, thank you so much. Can you guys hear me okay?
Yes.
Yeah, good. And I think Paul had some slides. I don't know, Paul, if we're going to get them up, but I loved it that you said about the farmers market and good eating, because that's very important, and also getting out and exercising. And Dr. Katie Richardson last month did a great talk about women's health. So we talked about, well, let's do a little bit about men's health, and some of it are overlapping. But there are some distinct differences between some of the men and the women. And I don't know, Paul, if you could just want to go on, and there's click with it or not. I'm not sure.
Do y'all see it?
Yes,
I can see it.
I can. And we don't have to go by with the slides, but we were just talking, maybe that would help. But the couple of things with it, and for those that don't know, Mr. Sheila is talking about what I do in family medicine. So we cover a lot of different areas, and men's health is very important. And right now for June. So the number one cause of death for men in the United States is actually heart disease. And a lot of us are aware of that. We also know of it in women. But how do we prevent it? We look at the ways that we can screen for it, and then also ways we can prevent heart disease. Looking at your high blood pressure and cholesterol, are ways that we can prevent it. And Paula, are the slides moving forward at all?
As you talk, I'll move them forward.
Okay, we can go to the first slide.
Oh, that's hadn't moved
I mean,
yet.
second slide, I guess, yeah.
Yeah, let me get, I'm sorry, I thought they had moved forward. Okay, that was the first one.
Oh, okay, can you go back? I'm sorry. Yeah,
Okay.
there, great, thank you. So like I was saying, the high blood pressure and cholesterol are out there. Some of us don't even know, especially men that don't even know they have it because we call it the silent killer. And why is that? Sometimes you can have some symptoms of high blood pressure, maybe a headache, feeling down, but a lot of times we don't even know that we have high blood pressure, and the cholesterol we might not know about, or we're not going to know about until we get some blood work. Also, we were going to talk a little bit about prostate cancer. I know that's a big thing in the news, especially with President Biden announcing that he had prostate cancer, metastatic prostate cancer. So I've even had a lot of men and patients and friends saying, "Oh my gosh, have I gotten checked? What do I do? What do I do about this? How did that happen?" So this is a great opportunity for you to have conversations with your family members or with your doctors. To get screened for prostate cancer, and it's the most common non-skin cancer in men. How can we get screened for the prostate cancer? It's usually a lot of people are worried, they get scared, they don't want to come to the doctor because they were thinking, oh my gosh, I don't want to have a doctor do a digital rectal exam to screen for prostate cancer. And so I speak with a lot of people, that's really not the only way that we can really screen for prostate cancer. PSA is prostate specific antigen. And at this time, this is one of the most specific tests in labs. So it's a blood draw that you can get while you're getting your cholesterol checked, your hemoglobin A1C, which is part of diabetes, your sugar, your liver. Digital rectal exam is sometimes needed, and we could go through that. Now, the PSA level, there are different ranges. Normal's like 1 up to 4. If your PSA level is over 4 in the blood, it does not necessarily mean you have prostate cancer. Sometimes you could have, and I forgot to mention the slide, but it's very important, benign prostatic hypertrophy. And that means when the prostate becomes enlarged, especially as men get older, then you can have problems with urinating and more frequency with going to the restroom. So there are treatments for that. If the PSA is high, then we usually refer to a urologist that does further testing to see if there's prostate cancer. And what's great about this is, I mean, it's not great to have cancer, but what's great is there's a lot of new technology that's out there to help people to have prostate cancer. And there's also ways to detect it and treatments. So it's very exciting what's coming down with the different cancers with that. So if you're over the age of 50 for men, you definitely want to get checked for prostate cancer and definitely the cholesterol, but also 45 and up, especially if you're African American, and or this is very important, you have a strong family history of prostate cancer. Okay, Paul, we can go to the next one there. And yes, so the blood pressure is important. Most of our diseases that we get, chronic diseases, as I've talked about, actually begin almost 20 years before you get it. Especially sometimes the heart attack, strokes, they begin 20 years earlier with that plaque buildup from the cholesterol. So the cholesterol is important because it lets us know about plaque buildup. And plaque buildup is very sticky, and that is what causes the hardening or the blockage in the arteries that cause a heart attack or stroke. And that's why it's important to get it down. Now, this slide says that cholesterol should be checked every 4 to 6 years from the age of 20. Actually, as you get older, especially 40 and up, or you have a strong family history, we actually recommend it every year. It is unfortunately more prominent that we've seen lately with young people having high cholesterol. There are ways to prevent it, and we can talk about it a little bit later, as we were already mentioning food, great foods, fruits and vegetables, exercising, and then also doing some strength training. And I'm not saying you have to go out to the gym and be a total muscle building, but at the same time, if we do some resistance strength training, that will help get that muscle mass and will help with lowering your blood pressure and also lowering the cholesterol. Another cancer that a lot of people think about is mentioned here is what it's talking about colonoscopy and FIT tests is the screening for colon cancer. Unfortunately, we've seen a big rise in colon cancer, men and women, but also in men. And we start testing now at age 45 and up. It used to be 50. So people who are thinking 50 have to do it. If you're 45 and up, please get tested for the colonoscopy. I mean, for the colon cancer. The gold standard is colonoscopy. Again, I have a lot of people and patients that are afraid. I mean, I didn't love to do my colonoscopy, but I did it. But there are what it says FIT test or Cologuard. You've probably seen commercials for it. These are ways that you could get tests where they screen for the stool to see if you have some of the proteins that would be causing maybe some colon polyps or colon cancer. If it's negative, it's a good chance you don't have any polyps or colon cancer. If it's positive, it doesn't mean you have colon cancer, but it does mean that you need to get that additional colonoscopy. So I ask, for people not to be afraid of it and then to get tested. The last thing, we already talked a little bit about PSA, and the other thing is talking about mental health screening. We talk about as people get older, especially men and women, but men tend to be lonely, maybe have feelings of anxiety, depression, feeling down, maybe some instances of problems with sleep or with substance abuse. These are things that can be spoken about, and we can talk about it by changing and preventing it by exercising, limiting some of the alcohol and the substances. Using now, you can even do apps. There's certain ones, Calms, that can help with meditation, being in social settings if you can get out and around other people. I know Paul and Mr. Shealy were saying about also, we have Spoleto being out there volunteering for different organizations, helps with that loneliness and the mental issue. Okay, Paul.
All right, let me get to move.
Yeah, that's okay. So when we talked about eating smart, food is medicine. We talk about lifestyle medicine, getting more fruits and vegetables, limiting processed foods. If you're watching with the sugar, and I mentioned very briefly about diabetes is also more, pretty prominent in men and women. But we look for the high fructose corn syrup. We want to aim for at least 150 minutes of exercise a week. And as I said, some of that strength training. Part of lifestyle medicine is getting enough sleep, 7 to 9 hours. We talked about decreasing your stress and staying socially connected. And one thing we've mentioned in some of our other meetings that's important that y'all have seen in the news is that alcohol does have an increased risk of different cancers, colon cancer specifically, but also in breast cancer. Even though I know we're talking about men's health, which is further along in the slides just for time, is very rare, but men can get breast cancer. And so if you have a strong family history of breast cancer in your family, and you do feel a lump in the pecs and all, please reach out to your physician and get it straight. And yes, men do get mammograms and ultrasounds. So, Paul, the next. So we just talked about waiting for regular checkups, encouraging men to help things and to get out there and get tested and be proactive. And I think we're almost out of time, and we talked about this.
You got
One of
time.
the two other things I didn't mention, especially in younger men, is important is testicular cancer. So a lot of times if your child or your teenager up in the 20 years old, if they ever have any nodules or feeling like in their testicular area, there is something going on, please encourage them to check with the doctor. I know a lot of people don't like to get tested in that area, but it can save their lives. Sometimes they need just a simple excision and they can get it. Thank you, Paul. can get it taken care of. So lump, swelling, or discomfort in the testicle. It doesn't always mean that it's cancer. It can be varicocele, which is the outpopping of the varicose veins in the area, but please get it treated because early treatment leads to survival. The other thing we talk about is erectile dysfunction. It affects up to 30 million men in the United States. It can cause by physical issues, heart disease, diabetes, blood pressure, low testosterone, medications. So it is common with aging, but it's not always something you have to live with. Please reach out to your physician. I know everybody's thinking just medicines, but there's also ways that we can work with lifestyle changes and all to help with this. Okay, Paul? Yeah, so, just one of these subjects, I could talk in great detail. I know it skipped a little bit over with the cholesterol and heart disease. I did just want to say just with that, make sure when you do get the testing, afterwards, I know a lot of people ask about what's a cardiovascular risk score. This is when the physicians, the American Heart Association, we look at your overall total risk of if you smoke, if your blood pressure is high, and what your cholesterol level is. And we look at what that risk number is. If it's greater than 7, that you're more at risk over the next 10 years of having a heart attack or a stroke. And then there are testing besides just a stress test. A lot of people order now a calcium score, which is a test, the CT scan, where we look for plaque buildup. But again, please, if you think you have an indigestion, any shortness of breath, having trouble walking upstairs, or any chest pain, please get in touch with your provider. But if you're having chest pain or shortness of breath, I would advise you to call 911 to go to the emergency room. And we can prevent all this, as we said, by eating healthy and exercising. So I think that's about it for time. I would love to have more time to talk about it. I think men's health is very important. And any questions or time, Paul?
You've got
Dr.
time.
Durst,
Yeah.
I have a question.
Yes, I'm not sure who that is, but yes.
That's Lisa Burbage.
Burbage.
Oh, hi.
Hey, the cholesterol thing, I know there's some new research that showing that even if you do all the right things, exercise, eat right, sleep well, you still may have a genetic component to high
Yes.
cholesterol. Could you touch on that a bit?
Yes, I didn't touch a lot on it, but all these diseases do have a genetic component. However, just because it is in your genes does not mean you would have it. But yes, besides just the regular cholesterol, let's see, especially if you have a strong family history, maybe your own father, brother, uncle, somebody had a heart event, and I mean more had a heart attack or stroke in their 40s or 50s, you definitely want to get it screened earlier. And there's some other markers, and there's so much research in this now that they look in the blood. One is called CRP, C-reactive protein, that looks for inflammation, ApoB, and then LP little a. So the cholesterol is, we do everything you can, but unfortunately, sometimes those people do have to be put on certain medicines to help lower the cholesterol. So that is a very important point for all of these. It's just if you're aware of your family history, get tested sooner. A lot of patients are adopted or don't know their family history, or maybe they don't talk about it. Sometimes, especially men, they're like, I don't even know if my dad had prostate cancer. So if you don't, then we want to get screened earlier. But there is a lot, like, again, we could just talk a whole hour just on that, but there are a lot of great information out there and new technology testing in the blood for that. And
Yeah.
part of the cholesterol, excuse me, is inflammation. So when you have the sugar or if you have diabetes, it causes inflammation in the blood. And when you have that, it causes your vessels to be more sticky, and that causes the plaque to stick and cause a problem. So those are called hard plaques and then there's soft plaques. And when you do have diabetes, you want your cholesterol to be even lower. That LDL number needs to be below 70. If you don't have diabetes, the LDL number, which is low density lipoprotein, which is the kind of bad cholesterol, you want it less than 100.
Any other
Any other
questions?
questions?
Thank you.
You're welcome. Thanks.
Paul?
I know it's a lot of information in a short period of time.
I just didn't know whether Jennifer wanted to jump in, just also and add anything else on mental health and maybe what y'all are doing with men's health in your area, Jennifer.
Sure. Yeah, I think you nailed it, Dr. Durst, on just asking the questions and screening. I happen to know your folks ask that question, mental health questions, and it's important for primary care physicians to do that and to check on folks because especially men, stigma can be worse for men to come in and get treatment. And so whether it's your loved ones, friends, or whatever, do ask questions and, try to identify whether they need help because men do tend to hide it a little bit more and different races hide it more. So yeah, it's put it out there, talk about it during dinner is what we always say. Make it part of your normal conversation to ask about, how people are to make sure that you can help identify those who need to get some help.
Yes. And I want to just say what Jennifer said too, that I know at Roper and I believe at MSC, but a lot of the insurance and initiatives now, what Jennifer is talking about was the PQ9, which is a scoring test of screening. And the great thing is now is that a lot of it's very private. When you have in the different electronic medical records, they're now screening even before you come in to see the physician. So your loved one or yourself can be wherever and go on your computer or phone and answer those questions, such as, are you feeling down? Do you feel like hurting yourself? Are you feeling tired? Are you feeling anxious? So it's more private, and that has helped, I believe, also. And just talking about it, that it doesn't mean anything's necessarily wrong with you, just here to work about decreasing your stress because stress can add to heart disease, cholesterol, diabetes, and other issues. And we love what Jennifer's group does. I've recommended so many people to so many of you guys here. Your mental health initiatives have been wonderful.
Paul, did you have something?
Well, I just want to remind everybody that Father's Day is Sunday, June the 15th, and I was reading on the Men's Health Work national site is one thing. One day is to do is to remember it serves as a way to acknowledge and appreciate the importance of fathers and father figures, fostering a sense of gratitude, love, and familiar connection. So I just thought as we with all of our parents and with all the ones that make a difference, everything we can do to remind each other to be supportive is something very special. And I appreciate both what Jennifer and Dr. Durst said.
Thank you, Paul. Yeah.
That's great. And I think that's important too, such as remember their memory, and then all these things help prevent, and I'm sorry I didn't mention it, help prevent dementia and Alzheimer's disease, which is another whole issue that we do screen for too. And there's a lot of great initiatives out there. And anyway, thank you. I love talking about this. Could talk a whole time on just one of it. So thank you for your time.
Yeah, well, if I can ask you one more question, Dr.
Oh yeah,
Durst.
sure.
I know you talked about limiting processed foods and you talked about high fructose, but I know I've been told recently, hey, if you can buy it and it's not in a box, if you can go to the seafood section or to the fresh vegetables or fresh fruits and stuff like that. But when we're looking at the back of a box, what are we looking for that we say, okay, we don't want this?
That's a great question. I always say if your grandmother couldn't pronounce it, it's probably not good for you. Some of it, a lot of them are preservatives. Even myself, I try to get all natural, and that's where it gets tricky. You could say, oh, it's all natural. Let me grab it. It is all natural, but some of it, like I said, the high fructose corn syrup, that you really try not to have that, or if it is in there, to limit. That's a whole nother thing about how much sugar Some of those are like 26 grams, 30 grams per serving, and you're not supposed to have more than that in the whole day. So if you have that and then you have alcohol, that's a lot. So also look for, and I'm not trying to do a controversy, but I do believe a lot with the different dyes that are in there, different preservatives. I know a lot of foods, some people have headaches and all. MSG, monosodium glutamate. If somebody does have high blood pressure, you need to look for the sodium. So you look for the sodium that's in there. But I do agree, and I know that they're on here, the huge initiatives with blue zones and eating healthy, getting more garden food and supporting our farmers market, and initiatives for cooking are good.
Great.
So if that makes sense, like a lot of those words, like I don't even know some of them, they're like, okay, I don't even know what that is. Some of them are preservatives, the xanthan gum aren't as bad, but it's those fillers that you don't necessarily need.
Okay, great. Thank you so much.
Mhm.
Any other questions for Dr. Durst before we move on? All right. Well, thank you very much. That was awesome.
welcome.
That was a lot of great information. I appreciate you doing that. I
Yeah,
did
you're
want to
welcome.
mention, I see Keith Waring, Councilman Keith Waring, longtime council member, second generation council member, Keith Waring on here. So we appreciate Keith joining us and being on as well. And certainly feel free to chime in anytime you want to, Councilman Waring. We would be happy to have you as part of our meeting. Dr. Durst?
Yeah, I'm sorry, but I do have to leave a little bit early and I didn't mean to jump, but I forgot to mention on, unless Paul was doing it later, since I'm also representing the Charleston County Medical Society, I forgot to mention about our awards for the school health committee. Can I mention it real fast?
Absolutely. Yeah, please do.
Thank you. I'm sorry if it's out of turn. So for those of y'all know what Dr. Key came on and discussed about the Charleston County Medical Society School Health Committee, which some of you guys are on. I know Dr. Katie Richardson is on. We had the year-long wellness initiatives where schools in the area had a competition to see certain criteria, and they work with the MUSC Boeing Center for Health also to see who won. And last week, it was a big announcement. Some of you already know, but it was C.E. Williams won our #1 prize. They had a big gathering there. Dr. Key and a lot of people did a surprise visit, and hopefully later we'll have some pictures and awards about it. There were some other schools, the ones second and third place. I can get y'all some information, but congratulations to that school. It was initiatives that were there, and I'll get more information on exactly what they did and all. But thank you for that.
Yeah, no, thank you for mentioning that. I have a lot of constituents that go to C.E. Williams, so or a lot of kids of constituents, I guess, a lot of children, and
Yeah.
Councilman Waring does too. So thank you for mentioning that.
No, they did a great job. So really congratulate them, and we can work on recognizing them and the other schools. Every school did very well, but they were the winner, so it was exciting.
Awesome.
Thank you.
Yeah, thank you. All right. Next up, we've got our community health update, and we have Lamar Hodges from the Department of Public Health. Lamar, if you would, I would let you introduce yourself if you would, and take it from here if you would.
Sure. Thanks so much, Kevin. Good morning to everyone. I am Lamar Hodges. I serve as a community engagement program manager with the Department of Public Health, working with the community engagement team. And of course, I'm going to present just some quick things in regards and updates on behalf of Dr. Richardson in her absence. And for one, I really want to go in a space where with Dr. Kay Durst, as she does talk about the information in regards to men's health and the importance. I also want to go in a space of just sharing when it comes to those persons who possibly, those men who does not have that access to care in regards to having a primary care physician. One of our community partners, the South Carolina Cancer Alliance, they're doing a lot of good work in the community this year as they're creating and working with a lot of our community-based organizations in the Charleston area to provide what we consider as those health screenings for males. And one of the things that they're doing is they're coming out into the areas that we are normally having for those community members to attend events and things of that nature, to host those events, which is very important. So one of the things about it is, of course, the information in regards to the Cancer Alliance for those males who do not have access to a primary care physician, because we know that as it pertains to access to care, sometimes is a challenge and a barrier. So, of course, you see the contact information that's listed there at the bottom, but it's just we would like to really go in a space of making sure that those males understand that it is important that they take care of themselves. We do understand that, of course, when it comes to the responsibilities and of life and what we have going on, oftentimes we put everybody as a primary, but we got to take care of ourselves as well. Also wanting to go in a space of just sharing some more information in regards to the Department of Public Health and what we are looking at as of this time as a focus point. It is hurricane season, so we want to definitely go in a space of just sharing some information in regards to that as we are preparing for hurricane season as this time is now, just making sure just to provide just some tips in regards to what that looks like for us and for the residents. Just know those evacuation zones. Make sure that you secure an emergency kit. Those kits consist of food, water, your medication if you're taking any, flashlights, those things that we normally think to ourselves are necessities for us. But we oftentimes in situations we go in a space where we're, oh, I have time. Oftentimes in situations, having these kits prepared is always a vital tool that we need and always need to have on standby. We always say go in a space of plan, plan, plan. When it comes to your communication, having your phone charge, being able to have all of those devices, cellular devices, or any other type of technology that you use to be able to communicate with people in order to let them know what is going on. So we go in a space of sharing that. Also, as it pertains to those our Charleston natives, we need to make sure, and our residents understanding our insurance coverage, making sure that our policy is updated and that we know what that looks like as well. Securing your home, making sure everything is boarded and things of that nature when it comes to your windows, your doors, etc. Also understanding the having to check for alerts, just being able to go to the website with the South Carolina Emergency Management Division, always providing updates in regards to what's going on, as we are now faced with a lot of rain weather. People will need to know now that there, of course, there is a hurricane as it pertains to now that is approaching. So things of that nature we need to be updated in regards to that. And the reason why you look at this as it pertains to health or even in wellness is because this is a vital, important part of being prepared for a disaster. Of course, as public health, as a public health employee, we normally assist with those disaster preparedness. So in the same sense, we want to make sure that our residents in our community is safe at all times. Of course, also want to go in a space for just providing updates in regards to some of our community events, of things that we got going on this month. First off, happy Pride Month. When it comes to Pride, has already officially begun for the month for this past on yesterday. We had an event going on with our agency. We have our SHAPE initiative, which is in a space of always being able to provide promote sexual health awareness, and we're participating in that event as well. We also have where on tomorrow, Saturday, they have a block party that is going to be hosted at the Common House. And that event is from 2 o'clock to 8 p.m. on tomorrow. And they also have an adult queer prom, and it's going to be hosted in Park Circle at the Community Pavilion from 6 p.m. to 10 p.m. As well as on Sunday, there is an event for worship service, as well as being downtown at the market. Be reminded that, of course, of the tentative of these events, if you like to come and participate. As well as the next, and there is a flyer for this, is the largest community event in the state. And of course, this will be our second health and wellness expo that will be held in the on June 28th. Different flyer, Paul. So the June 28th, 2025, at 2429 Millen Park Road, we'll have with the Health and Wellness Expo. We've done this event partnering with our community partners such as with the Molina Healthcare, Community Impact Outreach, as well as the Charleston Hispanic Association. Last year we had an excellent turnout. The weather was against us because we only had we were scheduled for 4 hours. We only was able to host the event for 2 hours. But the amount of people that we served within those 2 hours were over 500 families. And of course, when it comes to it, this event, we have our supporting partners. Why this is important? Because we provide fresh produce, and we thanks to our community partners such as the Low Country Food Bank for assisting with that. Our other supporting partner, the Federal Health Care Network, will be providing on-site medical and dental screenings for free. So we definitely want to make sure that that information is shared out there for the community. Of course, as well as our partners at MUSC, who will also be providing immunizations. As the time comes for back to school, a lot of times in those situations, the barrier of being able to get into the pediatric clinics for our children, as well as our health departments, etc. So we're giving this opportunity for the MUSC mobile unit to be on site to be able to provide these necessary resources. As of right now, we have over 30 community partners who are going to be in attendance to provide resources regarding prostate cancer, medical screenings, fresh produce, immunizations, information regarding STI and HIV. So we have so many different resources as it pertains to for mom, babies, all the persons of the lifespan that will be in attendance for this event to be able to provide this information. Because one of the things that we want to make sure is that, of course, we improve the lives of the people that we have in Charleston. And of course, the flyer is shown here. As it pertains to, we're going to have some music out there by the Latin Groove as well. So and of course, the city of North Charleston is definitely a major part in making sure that we are doing what needs to be done for the people as they are assisting with this event as well. So we do invite everyone to come out to this event that is going to be hosted on June the 28th. Okay, so the next opportunity that we have, which was shown earlier, is our partnership with the MUSC Hollins Cancer Center. Just want to promote, as Dr. K. Durst did talk about a little bit in regards to that area of the cervical and mammogram screenings. So, and why that is important. So here's another opportunity. Now we're telling you why it was important. Now we're giving you the opportunity to move in action regarding it. And so here's another opportunity here as our health department, Department of Public Health, usually go in a space of partnering with MUSC to provide services at our health departments. So of course, as we launch next month, for it to begin, where the mobile unit from MUSC will be on site at our health departments, providing screenings by appointments only. I must repeat that, appointments only. So the information in regards to calling to making an appointment at any of these locations, and we're going to start at the Mount Pleasant Health Department on July the 22nd. And then, of course, we're moving around the Low Country region. So oftentimes in this situation, you'll see there that we're going to tremendously go in a space where we're serving the community and providing access to getting those screenings done. We want to make sure that people are well aware of not only the importance of it in the education, but also know that the resource is there as well. So please, please feel free to take advantage of these opportunities. And that's all I have. Thanks so much.
Well, thank you, Lamar Hodges. Great presentation. Appreciate that. Any questions from anyone?
Kevin,
Yes, sir, Paul.
Lamar, do you want to introduce Cinti? And Cinti, do you want to talk anything about any topics, tobacco, anything else?
Oh, sure. I would love to introduce my boss. So yes, I'm on here representing for the Department of Public Health. I have my boss, Hyacinthi Mangu, as the Community Engagement Director.
Good morning, everybody. I do not have anything. I was just jumping to support Lamar, and just to hear the great information you guys share here, and what is going on in our community. So I'm here just for the sake of supporting. So thank you for having me.
Great. Thank you so much for being with us. Anytime you want to join us, jump in. We love having you on here. So thank you. Yeah. All right. Any other questions for Lamar Hodges? All right. We'll see none. We will move on to our community health and wellness updates. I don't think I see anybody from the Low Country Food Bank here.
Nick's there.
Oh, is Nick here? I'm sorry, Nick. I didn't see you on here. I'm sorry. Nick, if you'd like to speak there, we'd love to have you.
Yeah, no problem. Thanks ever so much, Kevin. Appreciate it. Paul, were you going to put some slides up?
I am. I'm trying to find them, but they're close.
They're somewhere.
Yeah, I went crazy on something. Okay. Did it come up? Nope.
Yeah.
I'll get it just a second. Hit the wrong button. All right. Technical difficulties on my end. Hold on a second.
Which one were you going to put up first?
I was going to do the PowerPoint
on the new facility.
But while I'm trying to do that, you want to talk about a little about the maybe you could talk about your commentary. I sent y'all out a note that Nick had put in the newspaper on Tuesday, and Monday or Tuesday, and I read it and I just applauded him. I was telling everybody about it. So I just thought maybe Nick would want to touch on that. And Nick, if you do that, I'll try to find the other slide that we were going to pull up.
No, thanks, Paul. Yeah, and thanks, Paul, for highlighting this as well. I mean, I think we're all aware of those of us that are paying attention to what's going on the news these days. The intent here was just to raise some awareness. First of all, just to highlight the importance of federal funding, the federal funding that we receive here at the food bank, but also federal funding that many of our nonprofit colleagues also receive as well, and the importance of what that federal funding does. I mean, here at the Low Country Food Bank, just to go off on a little bit of a tangent, I mean, we have 6 programs here that are funded through federally funded sources, and they range in scale. And they cover the TFAP program, for example, which allows us to get nutritious food out to communities that we serve across those 10 coastal counties. It includes supporting programs for our seniors, providing senior boxes. Over 3,000 seniors each month receive a highly nutritious food box. It includes our programs that support our child hunger programming as well, both in terms of the school feeding programs, the after school feeding programs. And also importantly, and sort of connects a little bit to some of what was discussed earlier, our nutrition programs as well, our ability to provide nutrition education is funded through federal sources of funding. So really the article was written, and the reason of putting the article out there was really just to raise awareness to the importance of the federal funding that we and our other nonprofit colleagues receive, but also the implications of the current budget reconciliation bill that is being discussed and debated now at the Senate level, and the implications that could have, specifically around potential cuts on SNAP benefits, and also on Medicaid benefits as well. And this is at a time when we are seeing increasing levels of food insecurity. As we all know, costs are increasing as well. And so therefore, our households and our neighbors that we are supporting are increasingly stressed. So any cuts that are made to SNAP are going to have some very significant consequences. SNAP being the Supplemental Nutrition Assistance Program, supplemental meaning that it's, in the majority of cases, supplemental to what our neighbors are already receiving through income, through potentially 2-3 jobs. So it is supplemental, and the importance of that means that it's not only enabling our neighbors to purchase nutritious food, but also enables our neighbors to be able to afford the other important essentials in their livelihoods, whether it be rent, utilities. So just drawing attention to the importance of any cuts to SNAP, and then associated with that with Medicaid as well. What implications will that have for many of us here, I think, as well, as the stresses that puts on the health service provision as well, and whether those resources that would have been available and that are potentially no longer going to be available, how's that going to affect the quality of service that's being provided, both in turn, especially out in the more rural areas as well. So, yeah, the article was drawing attention to what could be some significantly negative challenges and issues that our neighbors are going to face, not just from a food perspective, but across the board as well, if these cuts go in place. So again, it's a call. I think all of us here can resonate with this, but also a call to making sure that we do whatever we can to obviously limit the impact. I don't think any of us are against the modernization of systems and making sure systems are more efficient and more effective so that support can get more effectively to those that need it. So Paul, that was basically the gist of the article, and we will obviously be continuing to track this, and obviously hoping that it doesn't have the impact that it potentially has.
Great. Thank you, Nick. Appreciate that very much. Any questions for Nick or the Low Country Food Bank?
Question here. Just a second. So Nikki, I know you spoke about the SNAP aid and potential maybe the reduction of fund when it comes to that. So what does the food bank doing to encounter that moving forward? Because I understand that that's like a big bulk of funds, which a lot of folks who have like under saved or low income, under poverty rate, they pretty much depend on that, especially like seniors and so forth. So how can you help us to understand it moving forward? How can we help people, when they say like, hey, my SNAP aid is kind of reduced to pretty much minimum, and how can we help them to encounter that moving forward? What kind of services we have maybe in place we can help them?
I think we can all be a voice advocating for the importance of SNAP program, the importance and the value that it brings to those that need that support. So the SNAP benefits itself enable our neighbors to be able to go out and purchase nutritious food. There is also an economic impact on here as well. It could potentially impact our retail sector as well, because our retail sector could be impacted by a cut in SNAP benefits, because there will be less people shopping at those retail stores as well, which will have a knock-on impact in terms of employment as well. So all of this is cyclically connected. Specifically to SNAP education, the SNAP Ed is a component of SNAP that provides us with the resources to be able to provide the education, the essential education of being able to highlight the importance of nutrition, the importance of being able to budget effectively to purchase nutritious food, and to be able to understand how the purchase of nutritious food and how to transform that into nutritious meals as well. So we are doing, I would call all of us to be able to raise awareness to the challenges that will be created. From our perspective, we've been doing a lot of risk assessment and a lot of risk analysis over the last weeks and months to look at how we are going to potentially cope with any potential cuts. We feel that it's important to get ahead of the game here. And obviously, we will be depending quite a lot on our supporters of the work that we do. That includes our private supporters, our foundation supporters, but also our retail partners as well. Given the amount of food that we're able to acquire from our retail stores, there is no definitive answer to how we're going to address any potential cuts, but looking at a variety of different strategies at this point in time, and obviously hoping that it doesn't get to the point where we face significant cuts across the board.
Any other questions? Well, thank you, Nick Osborne, the Low Country Food Bank. Thank you so much for sharing that information, some very important information, and appreciate you taking the time to do that today. Nick, did you have something else? I'm sorry.
He does.
did you-
I'm trying to get it to pop up.
You
Oh,
did
okay.
There we go. So actually, I mean, this could be considered to be somewhat connected to what I've just talked about. We have been fortunate, as many of you may know, we operating across the 10 coastal counties. We have 3 physical locations. There's the one here in Charleston, one up in Myrtle Beach, and we had formerly a location, a facility down in Yemassee. This was a facility that was a small facility. It was 6,500 square feet facility. It was wholly inadequate for the need in the southern part of our service area. It was we rented a space off of a bigger warehouse, if you like. So we have been really fortunate over the last couple of years, and we've just completed the construction of a new facility down in Hampton County. We were fortunate enough to acquire some lands through the agricultural technology on an agricultural technology campus down in Early Branch, which has enabled us to construct a 20,000 square foot facility. We completed construction about 2 months ago, and it's now fully operational. One of the beauties of this new facility is that not only has it increased our storage capacity, but we've also been able to increase our refrigerated and freezer capacity there now. So about 40% of this facility, as you can see the slide here inside on the right-hand side there, is made up of refrigeration and freezer space. We've also been able to incorporate a refrigerated compacting, repacking facility, which will enable us to take bulk product, break it down into smaller components, and be able to provide that out to our neighbors, which we've not been able to do. So we're really excited about this. Again, it's a new facility that enables us to better take the limited resources that we've had to be able to be more efficient and more effective in the way that we service our community, especially at times when those resources are potentially going to become more challenging. As you can see here, we've also incorporated into the design some fairly significant conferencing meeting space as well, which adjacent to that has a teaching kitchen as well. That's a picture there. That's the conference facilities there that can either be one big conference room or it can be divided into 2. The idea behind here is that this is a facility that serves our neighbors. It means our partners can use this facility to be able to hold their meetings, to meet and engage and strategize. The teaching kitchen that we have adjacent to this will enable us to do our nutrition education work. That of course is so important. We can bring classes, we can bring groups in, our partners in, and develop that opportunity. Paul's flicking through there a green looking room. That's a volunteer restroom, because of course what will be really important for us is to be able to mobilize our volunteers from the southern part of our service area. Now, whilst this is in the southern area and serving our southern part of our 10 counties, it is incredibly important as to how this will also support our work here in the central part of our region, especially here in Charleston, because it enables us to receive product more efficiently. we can store it more efficiently, and we can better serve our communities here in Charleston and across the 10 coastal counties. So we're really excited about this. And as I said, we've been up and running now for a couple of months. If anyone's interested in a visit, just let me know. I'm more than happy to arrange an opportunity for anyone to take a look at this new facility. But again, it offers us so much more, especially at a time when we're seeing these challenges that we're facing across the board.
Wow, that's outstanding, Nick. Thank you for sharing that. What a great facility. That's incredible, and all you're doing. Thank you so much. Any other questions? All right. Thank you
Lisa
so
Burke.
much. I'm sorry, Paul.
Lisa?
Yeah, I had a question for Nick. Nick, my husband and I own a farm near your new facility, and we grow vegetables for Grow Food. But Grow Food doesn't take everything. They've got specific things that the restaurants are asking for. If we had some vegetables that we wanted to share with y'all, how would we go about doing that?
Well, if you can reach out to me, and I will put you in contact with the right person here. Then that's a really important point, and I should have mentioned it. Part of the value of this facility is it is strengthening our partnership with our local farm producers as well. We work incredibly closely, for example, with the Gullah Co-op down in St. Helena's, for example, and enabling us to be able to purchase and receive fresh produce. We're looking at about 38% of everything that we distribute to our neighbors is fresh produce. And that's increased from probably 7 or 8 years ago when it was around about 14-15%. So that the nutritional value of fresh produce is absolutely vital. So Lisa, if you could potentially reach out to me, and I will connect you with the right people to make sure that you can be able to make that and support the work that we do through that. That would be amazing.
Okay. I'll get your email from Paul if I don't have it on the distribution list. Thank you.
Thank you, Lisa. Appreciate that.
Okay, very good. Well, thank you again, Nick. Appreciate that. Thank you for taking the time to share with us. And if there's no other questions there, I'm going to let's see. I'm going to call on Jennifer Brush, I think, to tell us a little bit about the mental health conference.
Yeah, hi again, everybody. Yes, it wouldn't be a meeting without me talking about the mental health conference, and it is actually next month since it's June 4th already. Yes, but it's we now have up to 16 and a half CEU opportunities. Starts on a Wednesday evening and 2 full days on Thursday and Friday at the Gilliard Auditorium. Lots of great speakers about different parts of mental health treatment and substance use treatment. So if you haven't looked at it, please, Paul sends out information a lot about, it's on our website, but please look into it. It's a great event in Charleston, and we're looking forward to hosting it for the 13th year. Just a couple other things. I wanted to say, as of today, we have served over 21,000 people at 988. We are the second 988 call center in South Carolina. Trying to make sure we answer all the calls made in South Carolina by someone in South Carolina. It's getting busier, so that means people are hearing more about 988, but please spread the word about 988 being a place people can call if they need help. Also, mobile crisis is very busy. Our mobile crisis call center is very busy. And I think I may have mentioned this before. We might have been going through accreditation, but we actually did get our 3-year accreditation with the American Association of Suicidology for our 988 call center, our mobile crisis state call center, and our mobile crisis team here in Charleston. So we're really excited about that. And I did want to just mention 2 other quick things to kind of add to what Dr. Durst was talking about. We do have mental health and suicide screeners on our website, the state website. It is still DMH, Department of Mental Health, even though we are now called the Office of Mental Health. We don't have a new website yet. You can still find us there, even though we are the Office of Mental Health under the Department of Behavioral Health and Developmental Disabilities. But please we have an adult screener and a child screener that will be answered by a counselor within 24 hours. So it's another place to go if someone's wondering about what they need, or if they have if there's somebody to talk to. And lastly, just reminding people here in our Charleston clinic in West Ashley and our Somerville clinic off Ladson Road, we do take walk-ins. You don't even need an appointment to come in and get opened and be ready to see a counselor. So Monday through Friday, we do take walk-ins up to 3 o'clock every day. So we're here to help. And school's out, as I guess Maggie knows, and so we've got our school counselors trying to keep our kids engaged for the summer, and that's kind of my news. So
Great,
thanks
thank
for
you.
having me again.
Yeah, thank you so much. Appreciate that. Jonathan Kessler, did you have anything to add or piggyback on there?
Not at this time, Kevin, but thank you so much.
Okay, sure, absolutely. All right, and any other community updates? Anyone have anything we want to share? And Paul,
Hey,
help me.
Kevin,
Yeah.
I did. I want to send out to y'all, I'll send it after this meeting, but the Traffic and Transportation Committee on last Monday or Tuesday had a great update on the Ashley River Bridge bicycle pedestrian project, as well as the low line. And it's in the first 30 minutes of that meeting. And I want to send it to you because I think it is well worth everybody seeing just the progress that's being made. And then I saw where, Kevin, were you going to, I saw where Quentin Tompkins put on something that says, let me see what it says. One of the projects they got, the Project Impact Symposium, is coming up in August for community agencies and nonprofits that are invited to join to learn more about MUSC and what they can offer. And so I'll send out that flyer to you. The other program MUSC has going on this summer is the Kids Eat Free Summer Feeding is back. And any child can come to our cafeteria at the hospital and receive a free nutritious meal all summer long. It's a program in conjunction with the South Carolina, I guess the Department of Education and USDA. It begins June the 9th. And Nick, do you want to just touch on what I saw y'all were doing something with the summer feeding programs too? You're on mute.
Yeah, sorry, Paul. Yeah, no, I mean, our summer school feed program continues. Yeah, sorry, I don't have any other details on that, but if you want more details on that, I'm happy to share it afterwards.
All right.
Great. Well, thank you, Paul. Yeah, and yeah, you might want to take a look at that. What Paul's going to send you, the Traffic and Transportation Committee talked about. I know it's very, very exciting, particularly for our medical community, because we're going to have a pedestrian and bike bridge where some people that are working at MUSC and Roper St. Francis are going to be able to ride a bike across if they want to. I was in a physician's office and she said, "Aren't you on city council?" And I said, "Yeah." She goes, "Oh, I'm so excited about that." She said, I live off the Greenway in West Ashley, and I'm going to be able to ride my bike to work when it's good weather, when it's nice. So I think it's going to be a great thing. I know Councilman Waring well, he may have dropped off, but he was on here earlier. He did a lot to help make that happen. Made some phone calls to our senators and representatives up in Washington and helped to get some federal funding for that. A lot of work went into having that, and it's going to be so exciting to see that when it comes through. But a great amenity for the city of Charleston, but our medical group as well. So I appreciate you sending that out, Paul. Okay, is there anything else for community updates? I am looking closely because I know I've missed some hands earlier, but okay. Well, if not, I want to thank you again. This is such a valuable group, and your time is so valuable to us, and we appreciate all the contributions you make to this committee. And if there's anything the city of Charleston can do to help any of you, please reach out to Paul, myself, Councilman Waring, any of us, and we'll be happy to help in any way we can. But hope you have a great day. I hope you get out and enjoy it. Pack the umbrella. It looks like it's going to rain a little bit. But if there's nothing else to come before this committee, we stand adjourned. Thank you so much.
Thank you.